We'd also like to thank Blue Cross Blue Shield of Rhode Island for their support of this publication and the release event. Blue Cross Blue Shield of Rhode Island has been a long-time supporter of equity and information-based advocacy. I'd like to introduce now Carolyn Belisle, who's the Managing Director of Corporate Social Responsibility for Blue Cross Blue Shield of Rhode Island, to provide some remarks.
Thank you, Paige. Thanks so much. With my back to you. I'm sorry. No, I'll stand next to you. So good morning. Thank you, Paige. Thanks everyone so much. It's such an honor, really, for me to be here this morning to offer greetings on behalf of Blue Cross and Blue Shield of Rhode Island. I've had a real privilege in my role to get to partner with Kids Count for a very long time, as Paige indicated, to collaborate, create, and make change for kids in our state. So Blue Cross has a vision to improve the health and well-being by leading access to high-quality, affordable, and equitable care. It's tough to argue with a vision statement like that, and I think it's safe to say we all share in the belief that every child should have the opportunity to grow up happy, safe, and healthy. And clearly the health of the future of our communities starts with our youngest residents. There's also no question that today, more than ever, data is driving and shaping the important conversations about equity and about how to address disparities in essential needs and the social determinants of health. So my colleagues at Blue Cross, who, by the way, Paige mentioned, where equity is really a solid foundation of our overall corporate strategy, we continue to be grateful for this unique collaboration with Kids Count, which stands as the first clinical claims-based statewide data set of childhood overweight and obesity in Rhode Island. Since 2016, Kids Count, Department of Health, Health Center for Data and Analysis, Brown University School of Public Health, and 4 insurance plans have collaborated to collect accurate childhood overweight and obesity data at the state, city, town level, so that could be analyzed by race, ethnicity, age, gender, and health insurance status. And as we come together to hear this updated data today and trends on pediatric and adolescent overweight and obesity for Rhode Island, and to discuss the root causes, it's fitting that we're viewing the data today through a specific lens of racial and ethnic disparities, which have only grown wider and more alarming since the onset of the pandemic. Any of you who were here with us for this event last year might recall that the trends that we saw showing overweight and obesity decreasing from 2016 to 2019 reversed to an extent that wiped out any previous progress. We see and feel the tremendous impact on the mental well-being of our youth and the physical health of our youth, and that was only exacerbated by the pandemic. And while that alone is tragic, the disparities and inequities that are highlighted by this data are particularly troubling. With obesity linked to serious health issues that we are all deeply familiar with, diabetes, heart disease, cancers, and emotional and behavioral health issues, we cannot afford to be complacent, and that's why we are grateful to you at Kids Count for continuing to shine a bright light by helping us collectively name and understand root causes, and to organize critical conversations with residents to better understand the barriers that our families are facing and hear from them their own recommendations for solving them. We appreciate Kids Count's diligent research to learn approaches to address this issue so that together we can take action around those specific recommendations. Don't know about you, but I look to those regularly. This includes battling stigma, ensuring equitable access to nutritious and affordable foods for families, and increasing opportunities for safe and accessible physical activity for all children in school and in community. Blue Cross remains steadfast in doing our part and continues to make meaningful investments in programs like Summer Meals Program, Recess Rocks in Rhode Island, shout out to Jesse Jasper, Farm Fresh, Food Bank, you name it, so many partners. I hesitate to mention a list. But it's also why we joined Kids Count, Rhode Island Community Food Bank, and many other coalition members in support of promising legislation that would create a Healthy School Meals for All program so that school meals could once again be offered free of charge to students in Rhode Island. We will continue to advocate for promising solutions just like that one. Thank you all for coming today to hear this updated data, and importantly for the conversation from critical partners. I'm excited for the panel discussion, and thank you to Paige and Stephanie and Caitlin and everyone at Kids Count for the opportunity to support this project since the beginning, and for the tremendous role you all play in shaping policies for the betterment of kids in our state. I thank you very much.